everyone. I would like to present my PhD thesis, which is microbiome modulation in chronic inflammatory skin diseases. My name is Gabriella Mohos. I'm a medical doctor and a PhD student in Department of Dermatology, Semmelweis University. And our mission is to provide a better care for patients with chronic inflammatory skin diseases with a mission on implementing the microbiome modulation in chronic inflammatory skin diseases. I have two ongoing projects. The first one is about the microbiome modulation, and the second one is about the topical calcineurin inhibitors. So my first project is investigating the effect and safety of microbiome modulation in atopic dermatitis patients. About the background, atopic dermatitis is a chronic inflammatory skin condition affecting about 20% of children and 3% in adults. It has a decrease in quality of life and physical, emotional, and social impact. With severe atopic dermatitis, patients suffer from quality of life impairments, depression, or reporting suicidal thoughts, and experiencing social stigma or isolation, and has an impact in workplace and the school. Meanwhile, the gold standard treatments are moisturizer, topical steroids, and systemic immunosuppressants. These may not effective, or corticosteroids has some side effects like skin atrophy or an increased risk of infection. So that's why microbiome has a major impact on atopic dermatitis, which means there is a skin-gut axis, which means that the skin and the gut microbiota has in connection. And that's why microbiome modulation would be an effective and novel treatment. And microbiome is in a collection of the microorganisms, including the bacteria, the fungus, and the viruses. So our aim is to evaluate the efficacy and safety of microbiome modulation in atopic dermatitis patients. So the question is microbiome modulation effective and safe in the treatment of atopic dermatitis? To answer this question, we have a PICO framework. P represents the atopic dermatitis patient with a microbiome modulation intervention, including the probiotics, the prebiotics, the symbiotics, postbiotics, or antibiotics, compared to the placebo or the standard treatment. We measure the outcome with the disease activity, with some score system, like the SCORAD score, or the quality of life, depression score, the itch scale. We hypothesize microbiome modulation is effective and safe in the treatment of atopic dermatitis. And if that's true, then the clinical implication would be that atopic dermatitis patient can live a better life, and we can control the disease activity more. I have the search key, and I use as the first domain the disease, the atopic dermatitis, and for the second one is the microbiome modulation. I found three key articles with the same population with adults atopic dermatitis patient, with the same intervention, the probiotics compared to placebo, and the same outcome was a reduction in the SCORAD score. I found also three key articles with infants with the same probiotics, placebo, and a reduction in the SCORAD score. Before the duplication removal, I had almost 12,000 hits, and after the duplication removal, it reduced 9,500 hits. We started the title abstract selection and almost finished it. I hope we can start the full text selection by this week. Moving on to my second project, which is investigating the efficacy and safety of topical calcineurin inhibitors in immune-mediated skin diseases. It will be an international survey. About the background, the most common immune-mediated skin diseases is atopic dermatitis, vitiligo, seborrheic dermatitis, or psoriasis. We have two treatment line. The first line treatment is for atopic dermatitis is corticosteroids, which can cause skin atrophy and an increased risk of infection, but it is most widely used. And the second-line treatment of atopic dermatitis is calcineurin inhibitors, which are used topically. And they are immunosuppressants with two main active ingredients, the tacrolimus and the pimacrolimus. It has some benefits that they are not causing atrophy, or you can use on sensitive areas safely, like on the eyelids, but comes with challenges like photosensitivity or the compliance issues because of the theoretical increased risk of skin cancer. So that's why the effectiveness needs to be explored. So our aim is to evaluate the efficacy and safety of topical calcineurin inhibitors in immune-mediated skin diseases. So the question is, are calcineurin inhibitors effective and safe in the treatment of atopic in immune-mediated skin conditions? To answer this question, we have the PEO framework. P represents the patients with immune-mediated skin condition using topical calcineurin inhibitors, and we measure the outcome with the changes of disease activity, with the SCORAD score, or ESE, or in psoriasis, the PASI, or the adverse events, and the compliance. So we hypothesize topical calcineurin inhibitors are effective and safe in the treatment of immune-mediated skin condition. And if that's right, our clinical implication would be an extensive use, a more widely use of the calcineurin inhibitors in immune-mediated skin diseases, and a more safer and more widely use in this disease. Because it's the survey, then we will ask the expert opinions, and we will collect an individual patient data with the treatment effectiveness, or what was the primary condition prescribing these calcineurin inhibitors, the treatment duration, or the compliance assessment, or the follow-ups. To summarize, I want to submit my first project by September 2025, and my second project 2026. I want to end my presentation with a quote from Thomas Berger: "The art and science of asking questions is the source of all knowledge." Thank you for your kind attention, and I'm looking for the questions and the feedback.
I'd like to ask, what challenges do you or will you face with implementing microbiome modulation in the everyday practice?
So, to implementing microbiome modulation in everyday practice, we can challenges with the cost of the probiotics compared to the standard treatment, which is the corticosteroids, is much more expensive, the probiotics, for example, and the compliance issues that patients using correctly, and they are using these probiotics.
I would like to ask you, regarding your first project, what kind of probiotics or are you planning to include in your studies? Is it going to be a mixed or a systematic or topical? Thank you.
You can use probiotics widely, like a variation. And in our research, then we are using probiotics systemically. So they consuming probiotics, but there are some ways when you put topically on the places where the atopic dermatitis is an infection or an inflammation. So you can use topically, you can use alone or with corticosteroids. But in my research, they will consume probiotics only.
I also have a question. It was an amazing presentation. Can you give us some details regarding the postbiotics? I'm not very familiar with this type of microbiome modulation.
Yeah, so thank you for your question. Postbiotics are compounds, bioactive compounds of the probiotics produced by the probiotics during the fermentation, and it contains enzymes or cell walls or this so this kind of things, and they will benefit for your gut health and the overall disease.
I would like to ask you, what do you think? Why do only 10% of these people are using calcineurin inhibitors despite their beneficial effect?
Thank you for your question. I think they are using only 10% of the patient using calcineurin inhibitors because of the compliance issues, because there are a few side effects like photosensitivity, and there is a theoretical increased risk of infection. That's why maybe the clinicians do not prescribe these calcineurin inhibitors like tacrolimus or primacrolimus, and the patients want compliance good. So, and these calcineurin inhibitors are more expensive than the corticosteroids, so maybe it can be a reason for that.
I also have a question about the calcineurin inhibitors. You said they're used as off-label therapy. Can you elaborate on that a little bit?
Yes, so off-label therapy means that it's not approved by the FDA. So it can be used in other immune-mediated skin condition, and the clinician will decide the dosage or how can it apply, basically.